Yeah, good morning, everybody. I appreciate the opportunity to hear from everybody and get some refreshers on all the services that we have available for our patients after they leave here. Appreciate everybody's time and looking forward to the presentation.
Morning,
Well,
Sally.
thank you. Morning. Thank you, Matt Bergdorf and Chris Covero. We've been in conversation with SSM for the last several years to launch the behavioral health urgent care. And out of those conversations, some of the SSM leadership said, oh, please, let's do a little overview of the 9 primary collaborating partners with the urgent care, most of who've been in intimate relationship with SSM for decades, but especially for the last 10 years with the HCL inpatient program and adult DRE program. So I'm going to do a very aiming for being succinct overview of the safety net system, and then we'll start with each of the 9 agencies. And for the sake of our time together, when we say mental health, we mean mental health, substance use, and when we say behavioral health, we're trying to incorporate both. Next slide. So Behavioral Health Network is a planning coordinating entity for the Eastern region. We try and work on behalf of the safety net behavioral health service providers to support, which includes SSM, the increased accessible system for the full spectrum of services across the lifespan, with emphasis on uninsured and underinsured populations in the Eastern region. Department of Mental Health tends to divide the state into regions. So for when we say Eastern region, we mean St. Louis City County and the 5 contiguous counties around that there: Lincoln, Warren, Franklin, St. Charles, and Jefferson. Next slide. And primarily, the Missouri Department of Mental Health, particularly the Division of Behavioral Health, is the primary public funder of behavioral health services. They issue grants for services and facilitate, Medicaid delivery of services. Services are accessed through 25 service regions, where a service region is a particular geographic area, often called a catchment area. And the mental health services are delivered through community mental health centers, administrative agents, or affiliates. And they are responsible for delivering the DMH-funded services. These agencies determine a client's eligibility for services, and then they provide those services. But they also secure other grants. Some of them take in private insurance. So there's some variation in eligibility, even though there's consistency on what DMH, the types of services DMH will fund. Next slide. And the community mental health centers are the ones listed on the screen, most of whom will speak to you today. The ones that are listed first in red serve adults and youth. Adapt and Independent Center focus on adults. And there is a structure called a Certified Community Behavioral Health Organization that is looking into innovative payment structure. So 3 of these providers have that stack. Next slide. The Eastern region has a myriad of DMH contracted substance use treatment providers. The first 3 are primary partners with the urgent care and serve adults and youth. And the others are, amazing providers as well. Next slide. An example of services that are provided Our outpatient counseling, residential, crisis intervention, assertive community treatment, which can often be considered like the high, almost outpatient hospital level services delivered from your home. It's quite intensive. Targeted case management and community psychiatric rehab, CPR services. This is where mental health services, while it's the clinical and the medical, it also gets a bit into the social services, helping with activities of daily living, reinforcing ability to use public transportation or your house, support with your housing. The substance use disorder services run the following, the other side of the slide, where it can be comprehensive substance abuse treatment and rehab, often called C-STAR, which can be reimbursed by Medicaid. We have state opioid response, which I'll speak about a little bit more. Community support, recovery counseling. There's peer support services on both sides of the service delivery spectrum, co-occurring therapy, residential, and modified medical detox. So there's an array of services. Not every agency provides every one of them. That community, and that's why we're doing the show and share of each of the providers talking about their services. Next slide. And one of the things that we thought was important just for this audience is to say that the community providers can attend to your patients when you refer them to these, the array of community providers. They can attend to patients' medical needs and pharmacology for their mental health disorder, all in one location. Missouri was quite innovative and one of the early innovators in healthcare homes. And those can be primary care healthcare homes or community mental health center healthcare home. Next slide. A healthcare home can provide a comprehensive coordinated care in the, which includes medical, behavioral, and social support. And there's an emphasis on education, activation, and empowerment, very centered with the patient and their relationship with their team. So the gist of it is, when you refer, we can attend to the client's needs in a holistic way. Next slide. And sometimes you hear us talk about disease management. This is an initiative by the Department of Mental Health where they have identified Medicaid eligible clients who have a serious mental illness or substance use disorder, current or historic, and have in the past year generated high medical costs and are not currently in services. So Department of Mental Health has given grant funding to their contracted providers. They've given the co-rosters and said, please go find these clients and engage them in ongoing community care. So why we try and look for that status is there's some additional funding and outreach staff who can support clients who are on that roster. Next slide. And with the state opioid response, there are many activities in recent years that have been a part of this funding. What I wanted to showcase is it's two things. SSM gets to benefit from the increased access to outreach. We have the EPIC recovery coaches who come to the hospital after an opioid experience of a patient's presentation with opioid use. And there is a lot of work to support providers to increase screening, treatment, and medication assisted treatment, MAT. And I know that's a consideration on the urgent care's horizon. So, how it is that these providers in BHN are squarely eager to collaborate on that front. Next slide. And beyond the safety net, there are many other community behavioral health providers. However, for the urgent care collaboration, we've identified those that I have mentioned and Provident Behavioral Health, because they offer counseling services and therapy, but they also have prescribing professionals. So for the urgent care intimate collaboration, that was a criteria we were looking at. And Behavioral Health Response is an intimate partner in all of our collaborative work. They are the acute access crisis intervention provider, where they have telephonic and mobile outreach team response 24/7, 365 days a year. And they manage the referral process for our intensive outreach efforts, such as hospital community linkages and ERE. And if you want to know what one of your patients are currently open with a DMH contracted provider, you can call that phone number and check. So that is it for my sweeping overview. We were going to try and adhere to a tight time frame and ask our next presenter to start. If you have questions, please drop them in the chat, and we've built in a little cushion time in between various presenters, and if we have to overstretch, we'll try and address questions then. John, you want to take us from here? John Murphy's my coworker who coordinates BHN's collaboration with substance use services for youth.
Sure, absolutely. Thank you, Sally. Yeah, so I guess what we'll go ahead and start doing is if you did have any technical issues, kind of as a caveat, feel free to reach out to me through email, direct message me through chat, shoot me a text, whatever's easiest for you. And if you also haven't dropped your name, title, and organization in the chat box now, great, just to keep track of everybody that's here today. So what we'll do, just to kind of give you a little bit of overview, our purpose, of course, for this show and share presentation is to support the SSM behavioral health staff, to make even more informed patient referrals to the various community behavioral health providers. We've heard that there are so many, nuances, so many kind of specialties that all these wonderful community partners have, and so we wanted to coordinate this and put it together so that you all have a very good brief snippet of all these wonderful organizations. So each provider will take about 8 minutes to present on their key programs and services. Obviously, that's very, very hard to do, to summarize your entire organization in 8 minutes, but we're going to try to do it as best as we can. If we go over a little, that's okay, but we have some wiggle room. And right after I turn it over to our first presenter is BJC Behavioral Health, I will drop in the chat 2 supporting documents. One is this slideshow, but in a PDF version, and the other one is basically a large handout document. We asked all of the community providers to send over 1 to 3 pages of just like a review of their organization and basically everything that they're teaching with a little bit more additional info. So I'll be dropping that to the chat, but if you're not able to save it, all of this will go out through an email. Well. So kind of to give you a little overview of how we're gonna, what's gonna look like today, we tried to put each provider kind of with certain specialties. So like you can see Prefer and Queen of Peace are in the middle because they're more substance use oriented. So we tried to stack everybody together, but each individual kind of your lineup for today. And again, we'll be providing all this after the presentation. So with that, I would love to turn it over to BJC Behavioral Health.
Thanks, John and Sally. Hey, good morning, everybody. Will Letterman here with BJC Behavioral Health. I am the same-day access and outpatient program manager here. As far as fast talking, I do that a lot, so I will probably whiz right through this. So I wanted to start off by talking a little bit about what our mission is. Our mission here at Behavioral Health is to improve the mental health and well-being of the people and communities we serve who are impacted by mental illness. Next slide, John, if you don't mind. So we do have 4 locations. We have a North County location in the 031 zip code. We have a downtown location in the 103 zip code, serving some of the downtown areas. We have a South County location also out in the South County area in the 129 zip code. And then we also have an office in our in Farmington at our southeast location, and that is in the 63640 zip code. Because some people may not know that we do serve the counties. There's a few counties that we serve down there, as far as St. Francis, Washington, and Iron counties. And so we do also serve portions of St. Louis City and also St. Louis County. We run the gamut of ages for for services, 2.5 in our preschool clinic up to about 5, 5.5, or 6. And then from that, 99 years young is, is the oldest I think that we've run so far. So yeah, so we run the gamut of ages. Next slide. We do have a call center, and I know that SSM staff, you guys are currently utilizing that, through the behavioral health, the unit. To schedule intake referrals and things like that. So I know that you guys are working pretty closely with our call center to get those scheduled, sending over of information and things like that. We are also starting to come back to life, if you will, in terms of utilizing some of our in-person appointments. As some of the COVID restrictions are lifted, we are taking this up, obviously taking the necessary safety precautions, and we are working in conjunction with our call center to facilitate some of those referrals in terms of getting those walk-ins and things like that at our clinics. So just let everyone know that we are starting to open back up a little bit with those, and we also are utilizing, as many organizations are, the telehealth services for all of our modes of treatment, and of course that's per client comfort level. Some clients just aren't comfortable yet coming back into in-person services, so we do continue to utilize those services. Next slide, John, please. We do work primarily with the underinsured and the uninsured, and I listed here a few of the plans that we do accept through Medicaid and Medicare. And as you'll see in one of the slides later on, one of our challenges that we worked on for some time is the ability to accept private insurances. So that is one of our hopes, is that we are able to that we are working toward that toward making that happen. But for right now, it's largely the uninsured, underinsured with some of these insurance plans. Next, John. A lot of the key services that we provide, Sally mentioned quite a few of them. That was a great introduction for all those services, Sally, so good job on that. Mental health, substance abuse services. We have employment specialists who are working to job train, employ those who want to go back to work. I won't read all the services in the interest of time, but we do have a healthcare home team. As Sally mentioned, the disease management team. We have one of those. We have a deaf services team, a shelter outreach program that we're pretty pleased with. We're working with the unhoused populations. The ERE hospital liaison programs. We also have a internationally accredited clubhouse at our Farmington location, which we're also pretty proud of. So we do run a host of services. And if you guys ever have any questions about if we do offer a service or what we offer, feel free to reach out. I can definitely answer your questions. Next slide, please. So some of our strengths. I always have a hard time, bragging on, things, but we do, I listed just a few of them, of many. We are multidisciplinary. We do work, through a lot of programs, with a lot of programs. So we do cover quite the, the gamut for services. We're also very collaborative, as many, other organizations are. We do have, 2 of our community health workers that are currently embedded on the unit there at the urgent care at SSM. we continue to work on getting, our intake specialists also embedded there. A couple of the challenges, again, we're working on our ability to accept private insurances, and we are also, I do call this a challenge. We are working to become a CCBHO accredited organization within the next year. So that process has begun. So it's more to come on that for us. Next slide, John. Thanks. And what we need or want or would like from our partnership with SSM, and I think, two of the main ones primarily are the continued open lines of communication regarding the referrals coming from there. And as I stated, earlier, we continue to work on getting those intake specialists embedded on the unit, in hopes of, a quicker linkage to, to services, as referral from BHUC to our organization. So with that, I think that is it for my part. I will certainly entertain questions or, can respond in the chat, again, in the interest of time.
Yeah, definitely. I think since we are a little behind in our planning, let's go ahead and we can shift to our next organization, which is Compass. But if you did have any questions directly to BJC Behavioral Health, yeah, feel free to just drop them in the chat, and you can always stay on a little longer at the end to answer questions.
Thanks, John.
Absolutely, thank you. So now we will invite Compass to present on their section.
Hi, everyone. My name is Lauren Bruce. I'm the Director of Access and Urgent Care Services here at Compass. I oversee our hospital diversion program, so like ERE, hospital linkage. So we know many of you guys with referrals and things like that. And then I also oversee our disease management outreaches. I'll try and do this in under 8 minutes and get us back on track. But in general, for your sake here at SSM, we provide services to St. Charles, Lincoln, Warren, and Franklin counties, and then also 41 additional counties in Missouri. So basically between St. Charles and just outside Kansas City, we probably have a Compass location. We offer the gamut in terms of services. So in general, if we break it down to behavioral health, we have everything from psychiatry for adults and children, outpatient therapy and group therapies for both adults and children. We do psychological testing. We have community-based services or community support services for both adults and youth. We have a variety of school-based services in our region. So therapy, Pinocchio, which is like a little guy's, for younger kids that aren't in traditional treatment. And then also school-based community support services. And additionally, we have Clubhouse and just kind of like Sally mentioned as well, we have kind of the gamut of services. So everything from ACT to ACT and ACT-A. We have a new female women and children's ACT program running out of our Franklin County area. So really, these are kind of like the bigger points in terms of services that are offered, but within that, there are more specialized services that can be delivered as well. In terms of substance use treatment, we serve adolescents and adults, but we're the lowest level of that kind of that C-star treatment. So if someone needs kind of more intensive substance use treatment, we will support them in getting connected to one of our community partners who can kind of help meet their need. But what we shy away from doing is just handing them a phone number and saying best of luck. We will work to kind of warm hand that person off or provide some bridge services so that they can kind of get started and going so that they're not just kind of left hanging, because we do realize that it can be, the hardest thing of someone's day can be just walking through our front door and asking for services. So the last thing we want to do is tell them they have to go someplace else. So we want to help them get to that next place. And then also we are a FQHC, so we do provide medical, so both pediatric and family medicine. We have an express care clinic. We also have dental services available for both youth and adults. We have pharmacies on site at many of our locations. And then we've also been very active in the community with the COVID pandemic in terms of testing, and we're constantly running our vaccine clinics. So next slide. So how does one access our services? We have an open access process. So potential clients can come through our open access either over the phone, or they're welcome to present at one of our one of our offices between 8 and 4 every day. And what's going to happen during that open access situation is they will, if it's done in person, we will, let's see, starting May 10th, they have the option of seeing someone face-to-face in person, and or they may be put in an office and have a virtual appointment via telehealth. And if someone is still not, COVID comfortable, or, transportation is a barrier, they're welcome to do over the phone screening or a virtual assessment. So potential clients can call our kind of main number, that 844-853-8937, and they can begin that process over the phone with an operator. If they have the technology that they want to do a virtual assessment, a Zoom link or like a secure link, a Doxy will be sent to them, and they can do that. And just kind of knowing that when someone starts that process over the phone, they will be transferred to another, a formal clinician who would do that appointment. So depending on the time of day that someone calls or what someone's got going on in their life, they may be directly transferred to that next appointment, or they may have to, they may have like an appointment to like the next day or a few hours later to come and complete that assessment process with somebody. Next slide. So when folks walk through the door for behavioral health services, they will have a mental health assessment completed by a clinician. And then from there, the clinician will work with the client and make recommendations for potential services, whether it's psychiatry, therapy, case management, etc. We'll help that person kind of make a decision about what treatment's available to them, and then they can kind of help guide them towards scheduling appointments for things that they're interested in. The date of first appointment will depend on location and the programs that have been recommended. So I can say that I'm really proud to say that getting a psychiatry appointment at this point in time is usually 7 days or less for folks. And then therapy, again, it kind of varies on location and availability depending on what kind of specialty they need in terms of therapy provided. But most folks are seen within 2 weeks. And then just kind of reminding folks that that first appointment for the open access, they will not actually be seeing a psychiatrist or prescribed medications. So we are recommending if someone presents and needs medication immediately that they go to the SSM urgent care. But we just like to kind of have people kind of mentally prepared that they're not going to get medicine that very first appointment, but usually we can get them in 7 days or less. And then other kind of just helpful things. Agency-wide, our psychiatrists do not prescribe benzos or other kind of controlled substances like that. We work to, if someone presents and has been on those things, we do work to kind of help them come off of those medications. And then additionally, we do have a series of psychiatric nurse practitioners, and they are unable to prescribe stimulant medications. So sometimes people will be referred to a psychiatric NP and they are seeking a continuation of like Adderall or something like that, and they're not able to do that. So sometimes people get frustrated if they have to kind of bounce around to find the right provider to help meet that need. In terms of insurance accepted, similar to BJC, we primarily serve the underinsured or uninsured, but we do accept Medicaid, Medicare, and private insurance, and there's a bunch of them, and our staff can help you figure out that. If you are uninsured at the time that you present for an appointment, our staff will put you on a sliding scale fee, and they will assess that based on your presentation to our open access. For coming to open access, we always recommend that if you have an insurance card, please bring it. If you have an ID, please bring it. And if you're uninsured, please bring bank statements and or pay stubs. And then in order to access other Compass services, so the non-behavioral health side, such as primary care, dental, pediatrics, you can call that main number and they'll help you get connected for an appointment with those folks. I think that might be it. Is that it? Yep. Okay.
Yep. Awesome. I know that we did have one quick question. I think it can be answered pretty quick. Valencia asked, which Compass Health campus has open access?
Every single one. So everywhere we see behavioral health clients, we have open access available at that location. So if someone walks in, if there's a clinician not physically on site there, they will connect that person to a virtual appointment. They'll put them in a private office, connect them via telehealth, and they may see a clinician out of our Clinton office who will do that open access. But the goal is really to get people assessed same day and recommended for treatment from there.
Awesome. Thank you. All right. Yeah, that was very quick. Thank you, Lauren. All right, we will invite our next speaker from the Hopewell Center.
Good morning, everyone. My name is Angie Blumenthal, and I'm currently the Crisis Counseling Program Manager here at Hopewell. And I was asked to do this presentation for you guys, so I will give it my best. So next slide, please. So here at the Hopewell Center, the mission is to improve the quality of life for the mentally disabled by decreasing the incidence of mental disabilities and their negative impact through hope, treatment, and wellness. One of the biggest things that we do with our staff is to give our clients hope. It's not just in the name, obviously, but we try to instill that in all of our clients just because of history, trauma, or background that they come from when they get to our doors. Next slide. So we have a huge amount of different programs and services, very similar to the other ones that have spoke. We have an outpatient services that has the intake and evaluation, the case management. We have therapy, medication services, crisis intervention. We have home health care services, which we have a great team that does that. They go out to see the clients, or they can come in and see them in here as well. We also have a community psychiatric rehabilitation group, which is the CPR. Same situation with that, evaluation services, community support, medication services. We have a great set of CSS workers that when an individual comes in, they can receive a CSS worker that can help them with their daily living, getting them to their appointments, showing them natural supports, linking them up with any type of resources, whether it's social services, getting disability, etc. We also have, which is not in the slide, we do have a DM37 outreach individual, which I'm over that program as well. We have ERE program. In the picture, we have our residential programs. We have 8 residential facilities for men and women. We have one that's a co-ed one. Depending on, and the handout that is going to be given to you guys goes into detail because there's a lot of it, which age groups and all that stuff are in there. But we do also have a crisis bed. And all of the residential programs are 24/7 staff, whether or not they're there in the in the building or they can be reached. We also, which is not on the slide, we are working within this year to become accredited as well with CCBHO. We're also getting ready to open our welcoming center at some point this year. And one of the other things that I forgot to mention is our catchment area is downtown St. Louis and then North City. And then we do have some kind of in the South City area. The next slide. We also have a child and adolescent programs. This program is located in our children's building, which is at the 5647 Delmar location. We have a wonderful creative expressions staff, community supports there as well, crisis intervention services, therapy. We have school-based services where they go into the schools and help the students and clients. We also have the PSR, which is the day program. We have that for the adults and the children. We have the home health care as well for the children, evaluations and medication administration services as well. Next slide. So some of the additional programs, we have the supported community living program, which is basically depending on which, how the individual lands as far as if they have no income or they do have income, we have voucher programs for them to live on their own, maybe to help them with partial living expenses, pay half their rent, depending on if they're in RCFs. It just depends on how the client falls in that particular program. We also have a wonderful ACT-A program, which is the transitional youth, 16 through 26. That's a whole team approach. They have their own doctor, they have their own therapist, they have their own CSS workers, and they just particularly work with those individuals. They have also as well, they have staff there to help the individuals find jobs in that program. We also have a phases program, which is our co-occurring program. We have daily groups for those individuals. They can come in and attend all groups, or they can attend a few groups a day or a few groups a week. They also have their own integrated treatment specialist, which and their own CSS worker as well. Oh, the other program that I would mention, and I would be in trouble if I didn't, is my crisis counseling program, which is my FEMA granted program that we have been running here at Hopewell. It's our first time doing it. We have crisis counselors. It's for anyone that's impacted by COVID, whether it's staff, any of your clients, we can send out crisis counselors to assist you. We can also do presentations for your staff. We can also do presentations for any of your agencies that you're needing. So I had to throw that out there as well. We also have COVID testing and vaccination clinics at our People's Clinic. And I think that would be it. And if you have any questions, you're more than welcome to send me an email or call me. So, oh, and I almost forgot, starting Monday, we are starting our open access from 8 to 3. We have Monday through Friday from 8 to 3. You can either come to the adult building, which is at the 909 North 14th Street location, or the children's building. So we're starting that Monday. Sorry, sorry if I spoke too fast.
I thought you did perfect. You did exactly, I think you did like 7 minutes, so perfect.
Okay, thank you.
All right, and if anybody did have any questions for Angie, just feel free to drop in the chat. I know that we are a little bit still behind on time, so we'll go ahead and just skip for any comments, and we will move right on to, oh, sure.
I wanna share one perspective. Is those the 3 presentations were from the administrative agents funded by Department of Mental Health. They have catchment areas. So unlike the public health centers where I would be at liberty to go anywhere, the intention of Department of Mental Health is I would be assigned to receive my mental health services from one of those provider agencies based on my geography of where I live. The other thing is that Compass has a federally qualified health center, completely co-integrated in everything. Hopewell has a very intimate relationship with a health center, and BJC Behavioral Health offers a lot of healthcare home services under their roof. So we started with that cluster, and that's kind of how some of them are more similar. Okay, John, thank you.
Yeah, absolutely. No, that was a great thing to add. Yeah, so next we have Preferred Family Healthcare. I will welcome Beth to start presenting.
Hello, how are you? All right, 8 minutes or less. Okay, so Preferred Family Healthcare is a dynamic and caring organization committed to providing integrated care to assist individuals in achieving overall health and wellness. So you can go to the next slide, please. The big thing for us is we have program locations that have specific specialties. And so very quickly, I will run through these. Donica is now a federally qualified health center. It is in the city of St. Louis on the south side. It also provides substance use disorder services for adults with outpatient, and provides where our detox beds are. We have a 16-bed detox program. It has an addiction medicine clinic, which is medication first. So if an individual shows up at that clinic, they will receive medications to assist with their opioid use disorder. Detox program is specific to, we'll take opioid use disorder with complex medical needs. It is staffed by nurses 24/7, but really it's intended to detox off benzodiazepines and alcohol, where those individuals need a medical care in order to come off of those substances. It does provide employment services, primary care, and mental health services out of that location. Our Chippewa and Delmar locations, also in the city, our adult out and our Florissant location in North County serve adult outpatient with SUD primary, and also have employment services attached to them. Our Northrop location, located in the city, is adolescent residential and outpatient substance use disorder services. And I put the ages in quotations. Really, they're for 12 to 17. It gets a little confusing in our St. Louis County, St. Charles County, Franklin County programs, where we do have outpatient substance use disorder services, but we can serve up until the age of 18. So we can have 18-year-olds in our program, due to tax funding. So North County, South County, West County all have adult and adolescent services for substance use disorder in them. Next slide, please. We have a St. Charles Women and Children's program in St. Charles that has a capacity for 16 women and then an overflow capacity for children. We take children ages birth to 12 in that program. And it is you have to have a primary diagnosis of a substance use disorder to be admitted into that program. We also have a 20-bed St. Charles Men's residential program that resides on the same campus as that. We have a St. Charles, we have lots of programs in St. Charles and St. Louis City. We have a St. Charles adolescent program that is a 16-bed residential program and outpatient services. Those individuals do have to be 12 to 17 years of age. St. Charles adult outpatient and an addiction medicine clinic. Again, same day medicine if they were to need it, and see a addiction specialist to get that medication, whether that be a qualified nurse practitioner or an addiction medicine physician. Our Union, at Troy and Warrenton programs, Union and Troy have adult and adolescent outpatient substance use disorder services. Warrenton has adult outpatient substance use disorder services. So those are our primary populations that we serve in the locations that serve them. So next slide, please, John, or Sat, whoever. Our payer mix is insured, Missouri Medicaid, and uninsured. We do have a sliding scale fee for those that are uninsured. If you are in, and this is where it gets complex and we kind of sort that out. If you're in St. Louis County, St. Charles, or Franklin County, we have the ability to waive those fees for adolescents, so ages 12 to 18, if they're in an adolescent program. So next slide, please. Some of the things that kind of separate us out a little bit is we're a federally qualified health program in the city of St. Louis. Those are our strengths. They offer primary care at that location as well as SUD and mental health services. We have a state licensed daycare on site in our women and children's program, which a lot of people don't know about. And so while the women go to treatment during the day, their kids go over to the daycare and get provided services as well. In our St. Louis, St. Charles, Franklin County, we provide individualized prevention services for youth. Traditionally, school age kids is what we would say to people. So anywhere from 5 to 18. And we have a ARTSI program, which is, we love to talk about. It's achieving recovery, resiliency, and responsibility through creativity. And it's a strength-based program to showcase consumer talent and an alternative to didactic therapy methods. So does anyone have any questions? We just have a lot of services that it's really hard to wrap up in a tight, neat ball, but that's the best I could do.
Beth, one of the questions I've heard a lot of the hospitals are in conversation is a lot of people requesting residential detox, and that is so in short supply, and that some miracles can be made without going residential. Can you just speak to that a little bit?
So, you know, we firmly believe in the least intensive amount of services necessary. So if we have an adult or an adolescent, for that matter, who we can treat with medication-assisted treatment and addiction medicines in their home and have them come to day treatment services or outpatient services to get the care they need, then that is the best place to provide that. We are never going to have enough beds. It's never going to happen. We will work with an individual if it's in housing insecurity that they need and not necessarily a residential bed or detox, to get them into a recovery house or an appropriate house to also still provide medication assisted treatment or services should they choose to engage in them. So I think really getting to a place where we figure out how to deal with housing insecurities and how can we use recovery housing instead of inpatient, or that word residential treatment and acute care facilities. They're necessary in some instances, but not all. Is that what you were asking, Sally?
Wonderful. And I think we have one other question that Tori Drayton from BHN asked is, how engaged have clients been in the ARTC program?
We used our ARTC program in a variety of ways, and it's how we actually engage a lot of our consumers in care, is by that alternative strength-based method. So if a kiddo or an adult comes in and says, I want a garden, then we work up a treatment plan with strategic goals that allow us to have them do horticulture therapy. And so we just work it into every aspect of our care.
Wonderful. Thank you so much, Beth. And if there were any other questions for Preferred Family Healthcare, just drop them in the chat, and I'm sure Beth can answer them that way or can answer them in a follow-up. So next, I believe we have Queen of Peace.
Good morning, everyone. I am Amber Simpson, the Clinical Director here at Queen of Peace Center. As you'll see on the first slide, that is a picture of our building. So when you are referring clients, you can Google that or save that picture. Sometimes it is helpful for the clients to see the front of the building because we don't have a huge sign that says Queen of Peace Center. Next slide, please. So today I am going to focus on our C-STAR and SOR programs. So those are really the traditional substance use treatments in terms of residential treatments and outpatient services. So we are located at 325 North Newstead. So again, whenever you are referring a client, that would be the location that they would come to. The mission of Queen of Peace is to break the cycle of substance use for women, children, and their families through family-centered behavioral health care. Whenever you are referring a client, there's a couple of ways to do that. You can email me directly, and I've got the email in this, or I'm sorry, my email address in the slide. If you are emailing me directly, you can just do that via encrypted email. We also have a referral email address that is not on this slide. However, it is on the handout that I provided, so I believe everyone will receive that. So whenever you are referring a client, they can either come into our walk-in clinic, so that is 8:30 to 3 p.m. Monday through Friday. So they can just walk in and indicate that they are here to enroll in our services. If the client does not feel comfortable coming in or is better served virtually, you can also help the client get onto our virtual enrollment, which are those same access hours, but we use the platform doxy.me, and there is the link on the screen right now. So whenever you are referring a client, our identified clients for our C-STAR and SOR services would be adult women, so 18 or older, in need of substance use treatment. So that could either be residential treatments or outpatient treatment services. We also provide a ton of services to the families as well. So we have family therapy, child play therapy. We also have a therapeutic childcare center. So if you are referring a client to treatment, whether that be residential treatments or outpatient treatments, they can bring their children that are the childcare age. and the children can participate in that therapeutic childcare center during the times that they are in groups or receiving individual treatments. So we do offer residential treatment services, so that is up to 21 days. So if you have a client or a patient who comes in and is in need of residential treatment services, just know that that is up to 21 days. And if they have their children, they are able to be on the unit with them during that stay. Outpatient treatment services are Monday through Friday here at our building. So after our clients have enrolled, or after your referral enrolls in our treatment center, they have access to in-person groups Monday through Friday, 9 to 4. They also have access to MAT, so medication-assisted treatment, and then other C-STAR services or SOR services, such as sober living, transportation, and things like that. If you are referring a client, some things that are helpful would be a list of their medications, if they've had a psychosocial evaluation, if they completed detox. All those things are not necessary, although they are helpful, particularly when you are referring a client for residential treatment services. Let's see, some of the other services that we have peer and recovery support services. We have a pregnant and postpartum maternity home. So if you have a client that potentially doesn't need residential treatment services, but is in need of a therapeutic setting while they are pregnant to be able to have a substance-free birth, you can also refer them to our St. Philippine maternity home. And then we also have sober living. So if you have a client who is in need of outpatient services, but doesn't necessarily need residential, but they do need a supportive recovery environment, we do have a sober living recovery home at our OLPH location. Next slide, please. I do have some of that information on the next slide, as well as on the handouts. So yeah, those are our specialized services. The maternity home, our sober living facility. We also have an adolescent resource center, which focuses on education and prevention. And then we do have EPIC coaches here. So that's something that Sally talked a little bit about early on, but those are individuals who can meet the clients after an overdose or at the hospital to engage them in treatment services and then refer them here to our services. So again, as an overview, the best referrals for us are individuals who are 18 years or older and in need of substance use treatments, and women, of course. And some of the strengths, our strengths are that we do focus on pregnant and postpartum women. We have residential treatment, same-day MAT, and again, as I spoke about, the maternity and sober living homes. We are also able to provide COVID testing for our clients, so that has been helpful, particularly when it comes to moving into that congregate style living or on our residential units. In terms of referrals, yeah, we've received a few, so keep them coming. And then if you ever have a question about a referral, you can always reach out to me and we can try to tease that out. And I think that's it.
Wonderful. Thank you so much. So if anybody had any questions for Queen of Peace, just feel free to drop it in the chat and we will move on to our next provider. But thank you so much for that presentation. So our next provider is Provident Behavioral Health.
All right. Hello. My name is Brianna Massey. I'm the Associate Director of Counseling at Provident Behavioral Health. For those of you who aren't familiar with Provident, we have been around for a while, 161 years this year that we've been serving the St. Louis community, doing a variety of things. Next slide. So we have 4 main locations that we serve clients out of. We have our downtown location that houses all of our administrative team, counseling services, psychiatric services, as well as the location for our access center. And then we also have our northwest location located in the Maryland Heights area that is only used for counseling at this time. And then our South County office is right now only doing counseling services, but later on we'll probably also be serving people with our psychiatric services there as well. Our Jefferson County services is a smaller team. We have 3 therapists that are located in Jefferson County. All of those services are at no cost to clients for counseling services. Those are paid for by the Jefferson Foundation. And then we also recently merged with Mary Ryder Home, which is a residential facility for women 55 and up with significant mental health concerns that would otherwise not have a place to live. So those are our main locations. Next slide. All right, so the easiest way to find information on Provident is to go to our website, providentstl.org. You can browse everything from our locations, our intake line, our crisis line, as well as being able to see the bios of all of our clinicians that we have on staff, as well as our psychiatric providers. So that's a really good way for any prospective clients to be able to see a picture of who they're going to see, or even to look at the different bios, see who they might connect best with, and then they can call our intake line and actually request working with that person as long as the funding sources work out right. So that's something that we, definitely refer people to our website as a really good source of information. Next slide. All right, so Provident's mission is building brighter futures through exceptional behavioral health services, especially for those with the greatest need. We definitely are proud to be able to serve clients from a variety of locations. Right now, we are doing a mixture of some in-person services, and right now still mostly telehealth services. We definitely want to be accessible to everyone, especially those that also have financial difficulties. And so we have several grants that allow us to be able to see people at no cost, as well as a sliding scale fee, which I know other agencies have also mentioned, to make sure that each person is not turned away because of the cost. Next slide. All right, so, our strengths are why Provident, we are truly here to meet the needs of the community. We just launched our psychiatric services a couple of years ago because we know how difficult it can be for especially children to access psychiatric care and receive medication support. So we are constantly looking to see how the community needs to be served better, and trying to increase our programs to be able to meet those needs. Again, like I mentioned, we have multiple locations, are doing in-person and telehealth, and have a team of 27 therapists that are able to see clients, as well as 3 psychiatric mental health nurse practitioners to meet the need of the community. Next slide. So, similar to other agencies, we're serving those with behavioral health and mental health concerns. We see clients of all ages. Typically the youngest, I would say, would be around 4 years old. Anything younger than that, we will probably refer out to another agency that's better suited for younger children through 100 years old. Like I mentioned before, we have a lot of different funding sources. If a client lives in St. Louis County and is under the age of 20, their counseling and their psychiatric services are completely free to them. And so that is, extremely lucrative and something that we definitely encourage people to use. We have that funding. We want people to access the service, and they don't even have to pay for it if they meet that criteria of living in St. Louis County and are under age 20. Like I mentioned, the Jefferson County services are also free and at no cost. And then we accept private insurance. Medicaid for children, and Medicare for adults, as well as our sliding scale. Next slide. All right, so like I've already alluded to, we have our counseling services. We have 27 therapists of all different areas of specialty and different concentrations. So pretty much any concern we are able to work with the exception of substance use. Right now, we don't have anybody that's specialized or primarily trained in substance use, but any other mental health concern, we have people that are able to work with those clients. Our access center, again, located at our downtown location, is typically walk-in. Right now, we are starting with clients only telehealth, and hopefully in the next few months, we'll be able to do walk-in in-person appointments soon. But right now, the access center is open Tuesdays and Thursdays from 9 o'clock to 4 o'clock for, again, same day virtual appointments. Our psychiatric services, again, we have 3 providers. They are able to see children as young as 6 through adults. They have a variety of areas of specialty as well. And they are currently able to get people in as soon as 2 weeks out, I believe. So our waiting list is not very long, and so we're able to get people in a timely manner. Our crisis service department, we have located again at our downtown location, and we answer crisis hotlines 24/7. And so we are constantly referring people to call that number if they're not able to access their therapist or they're not able to access another provider in the middle of the night. We definitely want them to have that immediate support as needed. We also offer survivors of suicide support groups. And so I put the phone number there that can be reached, or the email address that can be used if somebody is needing to participate in a support group like that. They are also able to access that information through our website as well. And then, like I mentioned, the residential facility that we have, Mary Ryder Home, for women ages 55 and up. Next slide. All right, so, I know that we've been getting quite a few referrals from SSM Behavioral Health Urgent Care. And so one of the things that we have been working on is trying to streamline our referral process. So we have a new email address, accesscenter@providentstl.org, just to make it, much easier. That comes to me and to other staff that take care of those referrals. And then when we get those referrals, we just ask that we have all the signature pages that are needed for us to jump right in and start serving those clients. And I think that is all from me. Thank you.
That was wonderful. Thank you so much. If there were any questions, feel free to drop them in the chat. And I believe our next part is, Sally, did you have any comments on the last 3 presenters?
No, it's amazing that Provident has gotten prescribing professionals to be on hand and provide that support as well. So that it's really great.
Awesome. All right. Well, we are at our last 3. So we will invite CompTree. Oh, you have some animated graphics. Awesome. So you have somebody from CompTree on here. Go ahead and start whenever you're ready.
Yes, hello. So full disclosure, I did not create this. I am not a PowerPoint wizard. It was borrowed. So hi, I'm Amy Phillips. I'm the Vice President of Adult Behavioral Health Services at CompTree. And then I also have my peer on here as well for the VP of Youth Behavioral Health Services. Tony, if you want to pop up and say hello.
Good morning. I'm Tony Sikolik. I'm the Vice President of Youth Behavioral Health Services. I'm not sure if Jen was waving to me or just to the crowd, but I'm waving back to Jen Higginbotham.
So good morning, all. So we'll tell you a little bit about our services, what we offer, and how you access the services. So if we can go to the next slide. So this just lists all of our locations. So the locations that are more bolded, and I realize it's not super easy to see here, the ones that are more bolded are the offices or the locations that do have behavioral health services located at them. The ones that are not bolded, you can see our CAC is on there, as well as a safe place. And then a lot of there's our medical primary care offices as well. But as you can see, we offer services at a variety of different locations throughout Jefferson County. Let's see, so what do we offer? In terms of behavioral health, we offer a variety of different services. So as far as counseling, a lot of individual therapy options as well as group. I think there are some family options on the youth side. We provide case management and community support services. So the difference between the case management and community support services within our agency, case management is providing that community support office-based. So they might be assisting someone from the office versus if somebody has community support services, that staff is out in the community with that person. So just to kind of distinguish the difference between the two. And we also offer services with our psychiatrist for medication management, substance use services, as well as our psychosocial rehabilitation day program. So as far as eligibility, sometimes that will depend on the program. With us being the CMHC, the administrative agent for the county, we do have a lot of programs that are funded through DMH and Medicaid. It really just depends on the assessment, the diagnoses, and the person's level of need. And so we'll talk a little bit about how people access through our Welcome Center to get an assessment to determine the level of need and diagnoses. Some programs do require the person live in Jefferson County, or for the youth programs that they be enrolled in certain schools. And again, cost depends on the program, but we do have listed here, if someone's on sliding fee, the cost can be as low as $20 if somebody's not in one of our funded programs. Tony, do you have anything to add there specific to youth that I might have missed?
No, you covered it. I mean, a lot of our kids are Medicaid or following DMH services, private, and so.
Okay. All right, I think we're ready for the next slide then. Okay, so how do you connect? So we have open access via our Welcome Center. So prior to COVID, this was a walk-in. As of right now, we have not opened up the physical walk-in. So we encourage folks to call our Welcome Center at the number listed there. So they're taking calls as they would have taken physical walk-ins prior to COVID. So they start taking calls at 7:30 a.m. Monday through Friday. They stop taking those calls at 11 a.m. or until the available slots are filled. So of course, we encourage people to call as early as possible if they're trying to get in for services. And then two, as we're transitioning to more things in person, at some point we do hope to open the physical walk-in again. That just has not happened yet. But I did list central admissions information. They do all of our scheduling for our referred clients, and they would have updates to see if any of that has changed and have the most recent information on that. I think. Oh, and then we did hit the highlights on some of our other kind of more specialized programs. So we have our DMH programs as far as our mental health and substance use that offer some of the services already listed. We also have available peer support services within our mental health and substance use program. We have school liaisons, so therapists throughout the different schools in the county providing some counseling and support to the students there. And we also have our hospital community linkage program. So we have a liaison who is in constant communication with the local hospitals for clients who are hospitalized who need to get into our services. So we help streamline that to get them connected so they are set up and ready to get started when they get out of the hospital. Let's see, and then healthcare home. So that's really some medical resource type support for those folks that are in our DMH programs. We also have our community mental health liaison who is working very closely with law enforcement as far as referrals in the community if they're interacting with an individual that they feel may have more mental health needs. So they'll try to connect them with our CMHL to see if there's a way our services can assist rather than just immediately getting them involved with some legal concerns. And then we do have a housing program as well as just different outreach events, educating, of course, those look different right now, but educating folks on our services. And then two, outside of outreach events, we do have our outreach team who are consistently and constantly trying to engage individuals out in the community who need our services. Next slide. All right, so this just lists our mission, which is to lead in providing quality comprehensive healthcare that is affordable and accessible, and to support the dedicated professionals who make caring for the individuals we serve their #1 priority. And so I have our website on there as well as my contact information and Tony's. I know I kind of just flew through things on here for the sake of time, but if there's ever questions about a specific service or anything like that, we're both happy to help.
Wonderful. Thank you, Amy. Yeah, if there are any questions, again, just feel free to drop them in the chat and we will go ahead and move on to our next presenter. But thank you, Comtree, for that wonderful presentation.
Thank you.
All right, and next we have Places for People.
Hi, I'm Megan with Places for People. I'm our clinical director for specialty services. And I will go ahead and give you a big overview, but then also talk a little bit more about our immediately accessible services, which is what we are offering to the SSM Behavioral Health Urgent Care. You can switch it over. All right, so we are a certified community behavioral health organization, which means that we provide a vast array of services from birth until death. So we have got our usual rehabilitation services for adults. So that includes CPRP as well as ACT services. We have a Missouri Transition Age Youth team. We have an outreach team. We have youth and family services, which include not only therapy and psychiatry, but also a youth CPRP team, as well as youth ERE and youth outreach, as well as their own intake department. We also have adult outpatient SUD services, so the traditional C-STAR level 2 and 3 services, as well as medication assisted treatment. We have a specialty integrated treatment for co-occurring disorders team, as well as adult outpatient therapy and psychiatry services. So we have a big old breadth of services. The focus for the SSM Behavioral Health Urgent Care truly is adult psychiatry services. And the reason for that is that we can actually offer next day psychiatry appointments. We have lots of community partners for many of our other services. And so, of course, if individuals are interested in being connected with any of those services, we also offer our Welcome Center walk-in hours, which is not posted on here, but our website is placesforpeople.org. And you can locate all of our variety of services there. We are currently doing in-person and phone general Welcome Center walk-ins from 8 to 3, Monday through Friday. Our new location, we are all under the same roof, is located at 100 Lynch Street in Soulard, right next to the brewery, for good or bad. Yeah, we, like I said, this contact information for Sarah Springer is specifically for adult psychiatry services or therapy services. She can get folks rocking and rolling, same day, next day services for those adult psychiatry appointments. You want to move to the next slide, please? So our mission is to improve the physical and behavioral health of the individuals, families, and communities we serve, and those who support the provision of these services. So much like many of the other agencies that have gone before, we are really focusing on the integration of physical and behavioral health care. We also have a healthcare home, and our hopefully, fingers crossed, going to be starting a youth healthcare home in the near future. And so, folks that come to our agency really have the capacity of accessing a pretty broad range of services based on their need. You can move to the next slide, please. So, we are obviously a safety net provider. And so our adult psychiatry services really focus on those that do not need that higher level wraparound services. However, we understand that as a safety net provider, many of our folks that are enrolled in psychiatry services are some higher need folks and may have case managers in a variety of other agencies across the community. Currently, we accept Medicaid, Medicare, our 3 state-run MCOs, as well as Ambetter, which is an Affordable Care Act marketplace plan. We currently have a expansion grant through the CCBHO, which covers services for uninsured or underinsured individuals, which currently runs through May of next year. So this means that we can provide those services to individuals who are uninsured at no cost to them. We also really want to highlight our ability to enroll folks who are underinsured. And so that focus is really individuals who are insured, but maybe have one of those high deductible HSA plans with an income that falls below 200% federal poverty level. So that's sort of our sweet spot for folks, and that those folks are often the ones falling through the cracks. I'd also really like to highlight that our site clinic is exceptionally culturally competent and inclusive for those in the LGBTQI+ community. So not only do our therapists focus on issues of transition, but everyone there is knowledgeable and competent in working with that community. All right, so that was super fast. I know we have a ton of services, and I didn't want to get into the nitty-gritty with everything. So if you have questions, I'll type my email in the chat for everybody. Also, please visit our website. And again, lots of our services have specific qualifications. However, like I said, we are offering those next day services for adult psychiatry appointments. So please utilize that as you see fit. Thank you all.
Wonderful. Thank you, Megan. Yeah, if you have any questions, again, just feel free to drop them in the chat or reach out to Megan directly. All right, so we have our last provider. I guess we are right on time than what I had originally thought, thinking we got done at 11:30. So we should be good to go. But I will invite the speaker for Independence Center to join now.
Hi, I think I'm impressed. I think we're actually 2 or 3 minutes early. Good thing I hopped on when I did. But I'm Jennifer Higginbotham. I'm the Director of Operations at Independence Center right now. And I've been there for over 30 years and glad to be with you today, and really glad to begin to have this partnership with SSM, and just so impressed that we now have a behavioral health urgent care. Long time in coming. Go ahead. Just a few slides. Our mission, like many others, is to provide all the services and resources a person with a serious and persistent mental illness needs to manage their symptoms, find belonging and purpose, and to gain the independence to live a healthy, quality life. We're a private nonprofit community mental health organization, inspiring lives through dignity and purpose, celebrating our 40th anniversary just this last month. It's a picture of our sort of front building. Go ahead, John. Picture of our welcome center there, where we accept all of our referrals. Basically, we do not serve children. We serve adults age 18 and above with a diagnosis of a serious and persistent mental illness, and also people that have co-occurring substance use disorders. Our payer sources are basically Medicaid and Medicare, but we really truly focus mostly on somebody being an adult, having a mental illness, and then we're going to try to help provide those services and get you the resources that you need. The phone number there to call is 533-4163. We did have open walk-in hours before. We are not quite there, but we're staffing back up and getting closer to be able to bring that back online. I'm hoping at least, I don't know, if not May, by June. And you also have, I guess, in all of your materials, a flyer for our Welcome Center that lists the eligibility and how to contact us and that kind of thing in order to make a referral. Next. We also have similar services and a variety of services. We have an outpatient psychiatric clinic that we call the IC Health Group, providing psychiatric services with board certified psychiatrists from WashU. Also have a couple of counselors in LCSW and LPC that are doing individual and group counseling, including ITCD, the Integrated Treatment for Co-occurring Disorders, some illness management and recovery, and Seeking Safety Trauma Group. We provide community support services like many of the rest of the providers here today, also a healthcare home. But within our healthcare home, we also have a wellness center that you can see the picture in the bottom right corner. We actually have a workout room, a dance studio. We're offering exercise classes in a hybrid way, in person and virtually right now. It's sort of like a little mini Y. in the lower level below our clubhouse program. We also offer housing. We have 2 residential care facilities where we're offering the IRTS, the intensive residential treatment, and 2 independent apartment programs. So we have over 70 beds of our own housing, but then helping our members out in other ways to get the housing that they need. I think what differentiates Independence Center from the other providers on the call today is our psychosocial rehabilitation program, our day program that is based on the clubhouse model. You go to the next one. We're the only clubhouse model program in St. Louis. We're one of 5 accredited clubhouses in the state of Missouri and one of over 300 worldwide. And we're one of 12 international training bases training in this model. We're actually opening up to in-person training again starting in June and have people coming from Indiana and Michigan that are going to learn this model. Just a few bullet points of sort of to tell you a little bit about what that clubhouse model is like. We're creating a place where one finds belonging, hope, and purpose. When you join, you're no longer a patient, a client, or a consumer that's done to or done for, but a member of an intentional community that assists people with their recovery. We are an evidence-based practice using a community-based approach that help members learn new skills, hone their talents, remind them of their talents and their strengths, build dignity, and make progress toward their goals. We're creating an environment that decreases social isolation and increases self-confidence and self-worth, while providing opportunities around employment. You'll see our employment board there through transitional, supported IPS model employment and independent employment, and helping people meet their education goals, whether it's to get a high school diploma or like Terry in the picture to actually finish her 4-year degree at Fontbonne in social work. And I'm going to another graduation this Saturday. One of our members just graduated after over, I don't know how many years, but he's getting a fine arts degree and we're just so proud of him. The therapy is actually called social practice. There's some research around it, and the intervention we use we call the work order day. So people are a part of this intentional community working side by side with staff to really run the clubhouse program, increases their self-confidence, and then we can help people return to work and to school and build relationships and just have a better quality life. Go to the next one. But my favorite way to actually tell you about what we do is to actually share a recovery story with you. Probably not unique to others from other providers in the area, but I thought since I was last, I would just sort of end us on this note.
I started hearing voices at the age of 10. My parents thought I had an overactive imagination. And I was too scared to tell them that, no, I hear voices in my head. I used to get bullied a lot at school. People used to make fun of me. And it didn't help that I was hearing voices because I would often have conversations with myself because I'd be talking to the voices. And other people didn't understand that. They just thought, oh, she's just crazy, you know, don't pay her any mind. I was the only child that survived out of 6 kids from my mother and father. So my parents were very overprotective. And being the only child, I didn't have that sibling connection that most people have with brothers and sisters. So being isolated at school was even worse for me. It was like a never-ending lonely story. My mother had took guardianship of one of my cousins, and he lived with us. He was 5 years older than me. And he started molesting me at the age of 6. And this went on every day for 6.5 years. And I couldn't tell my mother that this was going on. So imagine being molested sexually every day, and add on top of that, you're hearing voices. Just the culmination of everything was just too great. I then had a suicide attempt. They held me in the hospital for about a week before they let me out. And my mother was like, we got to get you help. I'm like, no, you don't, I'm fine. And she was like, what happened to cause you to want to take your life? And I still couldn't open up and tell her, you know, I'm hearing voices, I've been molested. And that went on for a very long time before I finally sought help when I was 21. The Independent Center came out to the address that I used to live at. They left some brochures and a card. And I'll never forget the day. April 28, 2012, I came into the Independent Center on a tour, and I toured the clubhouse and fell in love with it first sight. And the Independent Center helped me find a good psychiatrist who actually listened to what I said, took everything into account when he's making his diagnosis. I felt like, okay, somebody's listening to me for a change, because for so long I felt like my voice had been taken from me. They got me enrolled in school back in college. I have since graduated from college with my bachelor's in psychology. And I saw a position at BJC Behavioral Health for a part-time peer support specialist. And I'm like, that's my job. I'm like, I'm gonna apply to that job. And I've been there now for 6 months. And everything is fitting like a hand in glove, like it's the perfect fit. I thoroughly care about my client because I see myself in so many of them. This is the first time I've ever felt like this is my career. The Independent Center helped transform my life from one of sickness and despair into happiness and joy and freedom. I wouldn't have a life if it weren't for the Independent Center. I wouldn't. I'd still probably be homeless. But I mean, I can say I'm a homeowner now. I used to dream of owning my own home. And that dream has come true. And the Independent Center helped me get there. They helped me believe in myself when I felt like I wasn't worthy to be believed in. And they never gave up on me.
I know there are plenty of other recovery stories out there, but I just thought it might be a nice way to end all the presentations this morning. Brittany actually came in through the 3700 project, the high utilizers of Medicaid, and that gentleman in her home, Stanley, was also a fellow member who she also married throughout the years. And so it's been a nice partnership that she's got the job at BJC Behavioral Health now. I forget how long, but longer than 6 months now. So we're accepting referrals for psychiatry, community support, our clubhouse program, and for counseling. And thank you. Any questions?
Jennifer, that's lovely. Wait, and so SSM Partners, this is exactly while you attend to folks in their moment of acute need and crisis, this intentional transitioning of patients to ongoing community supports so they can pursue that recovery path and claim their lives is what we are collectively about. We'll follow up with the referral processes. Yeah.
I had a quick question, not trying to interrupt. What was the name of that video? Because sometimes our clients, that'd be great to show on the floor when we're trying to get our clients to follow up. They think it's pointless. You know, they think they're going to go somewhere and it's going to be like overnight. And it'd be great to show for them to see like a patient who actually did do well, who went through the process. So I was just trying to see like, what was the name of that video?
John just put it in the chat and it is on our Independent Center YouTube channel. But
okay,
yeah,
thank
I
you.
just check it in there. Thanks. Brittany's proud to share that story.
So conversations, I want to honor that we're at our time, but these are conversations to be continued with tools and resources for the hospitals to refer. And we've tried to streamline it with one referral phone number through the HCL and through some strategies for the urgent care, but we'll keep refining things until the referral process is as easy as it can be.
And Sally, this is Chris from SSM. I want to just send a special thanks to you and John for all your work putting this together, and Melissa and company. It's fantastic. It's a great avenue for all of us to get together and collectively work to improve behavioral health across the region. So thank you all so much for facilitating this. And I got to believe what you said is hit the nail on the head. This is just the beginning for all of us to continue to collaborate to improve behavioral health in our patients. Thank you again so much.
Thanks for making it happen, Chris. Thank you. Okay, until next step. Thanks.
And just so everybody is aware, this, like I mentioned in the chat, this presentation was recorded. It'll just take a little bit to upload it and edit it a little bit to streamline it. But between that, the handouts, there's about a 15-page handout that I put in the chat earlier on, but I'll make sure to send this to all of you on this call. And then the slideshow also will be on a PDF, will be attached to that email as well. But be on the lookout for that over the next day or two. And you should have all that information available to you.
Thanks, everyone.
Nice job, everybody.
It's really wonderful.
Have a great day.